My name is Jennifer Reyes. I am the Health Programs Coordinator. I'm the one who's in contact with many of you guys, asking you for information about your events, when they're taking place, so we can, have that on our calendar. That way it's easily accessible to our community members, whether they go to, vacunatehoy.org, or if you guys send us our flyers, we can, support by posting that on our social media. And I'm joined with Sandra. Yes, okay. So we're just going to be introducing ourselves, and then the Vacunate Hoy initiative, our partnership with Walgreens. Then we'll have Jean answering questions about in-person vaccination clinics that we have developed. And if you guys have any questions, you can definitely ask toward the end of the training. And then we have Charlie, who will be answering questions more related to COVID-19 vaccination information. That'll be like the development of it, like why was it streamlined so quickly? He'll be answering questions along those lines. And then towards the end, we'll have questions. We'll have time for question and answer. So who are we? We are the League of United Latin American Citizens, the nation's largest and oldest civil rights organization that empowers Hispanic Americans and builds a strong Latino community. We're headquartered in DC, but we're founded in Texas. And we have councils throughout, the country, and including Puerto Rico. We do services involving advocacy, we do health, we do education. And if you want to learn more, you can go at www.lulac.org. Okay, so what is Vacunate Hoy? So when we first started this at the beginning of the year, it was more geared towards spreading information, whether that be through marketing campaigns, radios, PSAs, media. That was kind of the first phase of it. Then it transitioned to Yo Me Apunto, which was a sub-campaign, which was geared more towards essential workers, because what we saw was that those who were most impacted by COVID-19 were these people who were putting themselves at risk, doing frontline work, whether they be healthcare workers, restaurant workers, along those lines, promoting the idea of, getting vaccinated and how it can help protect you and your community. And, just promoting safe and healthy work environments for these workers, so they're not, being, abused or mistreated. And then now is where you guys come into our Vacunate Hoy initiative, where now we're in phase 3 of our initiative, where we're donating stipends to our councils to host these events, in your local communities, whether that be canvassing or hosting pop-up clinics. And that's why we're having these trainings, to help be that support for you all to have these successful events. And if you have any questions, we're here to answer. And like I've mentioned before, Walgreens is also open to the opportunity. And we've had about 3 councils say that they wanted to partner with Walgreens. And again, if you have, or if you want to partner with them, please reach out to me and I'll get that information to them. Okay. And then, Alethea, oh no. Can you guys still hear me?
Yes, we can. I think you can just X out or minimize that, Jennifer.
Okay. I was like, oh no, did it end the meeting? It's not letting me. Okay. Okay, let's just do that. Okay, and Alethea isn't joining us today, so I apologize for keeping that slide still in there. But we are joined by Charlie John, who is a pharmacist and director. He does more of the public policy end. And then we have the pharmacy manager, Jean Lim, and she's the one in charge of the vaccination clinics, going around or happening in the Los Angeles area. Are they on the line? Sorry, I can't see.
Yes, Jennifer.
Hi, Jennifer, I'm here.
I'm sorry. Okay, it's not letting me see you all. Okay, yeah, so would you all like to introduce yourselves? We can start with Charlie.
Sure thing. Good afternoon, everyone. My name is Charlie John. As I'm seeing my video screen, I'm staring at that picture and the many ways that I've changed since that picture was taken. But happy to be here with everyone. As Jennifer had mentioned, my name is Charlie John. I am a director of U.S. public policy for the Walgreens company. The main effort about that is to work with policymakers around the advancement of pharmacy care and healthcare in general. I work alongside with Alethea. If she was here, that she'd be able to describe her role, but it's more around working, again, with policymakers, many of the folks, the legislators that sit up on the Hill here in Washington, D.C., advocating for policy that is for pharmacy care and for healthcare in general. I'll pass it on to Jeannie.
Hi, I'm Jeannie Lim. I am a Walgreens pharmacy manager in downtown Los Angeles. Basically, I'm also the lead for the LA team for our COVID-19 testing efforts and our offsite clinics for medically underserved areas. So I'm just here to kind of help out. I'm basically boots on the ground and making sure that all of these clinics are coordinated and planned. And so I will definitely try to help you as much as I can to make sure that you guys have successful clinics as well.
Thank you so much for joining us today. And again, we really wanted to go ahead and set this time aside for our LULAC councils to be able to ask questions related to vaccinations, the development, really being able to go ahead and turn around the information that they are picking up from this training and workshop to be able to go back into their community and have these conversations as they canvass, as they host pop-up events. Again, the goals of the workshop is really understanding what is clinical research, what are clinical trials, having a clear understanding of safety testing behind vaccine development, and then of course the approval process. One of the biggest flags that we get in the work that we have been doing is, why was this fast track quickly and how? And then of course, tackling misconceptions of vaccines, being able to go ahead and talk about the COVID-19 variants that are so rampant in the community now, really talking about the vaccine effectiveness, when it comes to COVID-19 variants is something that's very important for us to be able to translate that information into the community as well in an understandable manner. Again, we are also seeing back to school pick up in person, being able to go ahead and have these conversations with parents, with youth on the importance of getting vaccinated is something that we really need to make a push for during this time as well. And then of course, being able to learn about the best practices for hosting pop-up clinics and working with the community. So again, thank you so much to both of you for joining us. This partnership with Walgreens is just something that is so valuable to us, because even before COVID-19, we were always doing work in the community, being able to bring education, being able to bring awareness to so many issues and so many health inequities that Hispanics all over the United States face on a daily basis. So thank you so much. Moving on to the next slide, I do want to go ahead and start with Jeannie, just being able to share your expertise on the ground with pop-up clinics and in-person vaccinations. Not everybody has the accessibility to schedule a doctor's appointment. They don't have insurance for one reason or another. Being able to bring this service directly to neighborhoods that are in need is something that is such an important part of COVID-19 vaccination. So I do want to go ahead and start off with asking you just some of the background of putting together a pop-up event. What are some of the items that our council should keep in mind as they host and scout for locations, and really being able to go ahead and talk to the community about getting vaccinated? You're on mute.
Sorry, I don't use Zoom a lot. We use Teams for work. So I apologize. But first, I just want to thank all of the volunteers today on this call and LULAC for mobilizing all of its members to drive vaccine outreach and playing a critical role in helping protect our communities, especially our medically underserved communities, against COVID-19. It is really what we need to help the country emerge from this pandemic, right? And we all have a personal stake in this, whether or not you've had family and friends affected by the pandemic, whether you were personally affected by it, or if you just want things to go back to normal and be able to see your family, travel, have kids going back to school safely, go to concerts, or just have peace of mind. I just want to be able to hug my grandma again, right? So all of these things. So thank you so much for volunteering and trying to help with this effort. Dive right into going over the stuff for the clinic. There's actually not that much. So as far as identifying health partners for us, once it got out that the vaccine was available and that Walgreens was giving out, was going to be able to administer the vaccine, we actually didn't have to do a lot of cold calling. People came to us because a lot of communities wanted to make sure that their community members were being vaccinated. So, the biggest thing is if you get the word out there that you guys are helping with this and being able to have a connection like Walgreens to be able to create pop-up clinics, or not just pop-up clinics, but education clinics or training clinics like this, then they will come to you. They will call you. The only time we really had to do any cold calling was in the beginning when we had to identify all the LTCFs, so the long-term care facilities, and then call them one by one, hundreds of them, to set up the clinics with them to make sure that the patients and their staff there were vaccinated and protected. So a lot of that is, stuff that they did for us, and we just did calls. But other than that, basically Walgreens connects with civic leaders, advocacy groups, faith-based organizations. Oh, I had trouble when I was practicing that too. Sorry, guys. But so basically your local church or anything like that who wants to have their members vaccinated, those are good opportunities. We were really fortunate that we worked with the LA Department of Public Health very early on. And so they were very, very good about feeding us organizations or schools or community groups that were basically interested in having a pop-up clinic, or having a pharmacist come and speak to them on the education piece, and talking to them a little bit about vaccine hesitancy, and making sure that they had all the information they needed in order to get shots in arms. So that was the biggest thing, is having that connection. So we were able to work with, like I said, the LA Department of Public Health and the LA Mayor's Office, and they helped to identify specific zip codes and specific neighborhoods, basically in areas that they wanted us to have a pop-up clinic, or even having marketing campaigns and stuff to talk to people regarding vaccine hesitancy. So those were all very helpful. And then, so your second question about how do you request a partnership with Walgreens or any other partner? For us, we count a lot on our local stores. With you guys, I think because you guys have a national relationship with us, I believe that Sandra and Jennifer are your point people for you to make contact with and speak to. But let's say you find a health partner that wants to do a pop-up clinic and they don't know where to start, and they want you to be a partner, but they don't necessarily want Walgreens or whatever. There are a lot of organizations out there, nurses and doctors' offices and things like that, that if they have a supply of it, they might be able to help you. With Walgreens, we actually have little buck slips with a QR code and a link that organizations can actually just scan or go to and be able to get more information or be able to submit their name and their information so that somebody on that team, on the outreach team, will be able to contact them and set something up. Obviously, a lot of these events also have to do with, resources, because right now with the surge, is it more beneficial for us to use our resources and our manpower inside the store versus going and doing a pop-up clinic? Because even now, even with the surge, we are seeing more immunizations, but at a lot of the pop-up clinics that I have been doing specifically, we've definitely seen, lower turnout. And that's because either most of the patients have already gotten the vaccine or the whole vaccine hesitancy piece, right? And that's part of the education that we need to make sure that your volunteers have, or that we give them enough information that they're confident enough to go out there and be able to address people's issues and concerns and be able to answer their questions with confidence. And so third question, how does a pop-up event look? Well, that depends. So we've done many different kinds of clinics. Like I said, we did clinics at the LTCFs. We've also done employer clinics, so business to business clinics like at Amazon and Amtrak and things like that. And then at these clinics, we've had our mobile clinic that I believe that Sandra, you also went to in LA, and where we had basically a bus travel to 30 different cities or 30 different cities across the US to vaccinate people. And that was really great. Basically, we love that because that is, people bring up the excuse that they don't have time or they can't go to a pharmacy to get the shot. And we basically brought the shot straight to them. Dragged a bunch of people off the streets to, convince them to get the shot. And that's probably what a majority of your events are going to look like now, because people who wanted the shot or people who've been waiting for the shot definitely have probably already gotten it or found a way to do it. So the people that we're looking at now are probably people that are going to have a lot of questions, and hopefully through this presentation, we can provide some of those answers for you. But as far as the event itself, that's basically the planning piece. Once you partner up with a Walgreens or you partner up with whichever organization you do, who's going to be actually administering the vaccinations, they're going to do a bulk of that work. Like for us, we make sure that we are always over prepared, right? It just depends on the volume you're looking for and how big the event is. We've had events where it's just me and one technician. We've also had events where I had like 25 people to 30 people working, depending on how big it is. We had events at the LAX vaccinating their employees and as well as the public, and at LA Metro vaccinating their employees and the public, and those were about 1,000 each. So we had about 20 people working. You just always want to make sure that you have enough people for crowd control, you have enough immunizers, and then depending on your state laws, sometimes for our immunizers, pharmacists are able to immunize as well as certified pharmacy technicians. However, in California, whenever you have an technician immunizing or two technicians immunizing, you always have to have an extra pharmacist to supervise. So you always have to make sure that you're aware of those kinds of things. But a lot of times your partner will take care of that for you, especially for Walgreens. We're definitely very conscious of all of those legal requirements. You want to make sure you have enough people to observe, and then people who, in your events, particularly translators, people who are bilingual, who will be able to assist patients with filling out the form, and in canvassing, meaning going out there and actually speaking to people. And I'll have some points and stuff, things that worked for me when we're speaking to people, just kind of off the streets or, when they come into my pharmacy. So those are all just some of the things that it looks like. We've had, a lot of really successful events and some not so successful, but the whole point is getting shots in arms, right? If we can get even 6 more people or 7 more people, to get there, or, we're not going to get the numbers like thousands like we were in the beginning, except that now that because there are mandates and things like that, you may get pop-ups that where people who might be required to get it for work and things like that. So hopefully that'll increase turnout. I know that we have one for a cruise line coming up where we actually have to vaccinate, I think, 1,000 people, and it's 100% attendance because they cannot even ship out without every single crew being vaccinated. So that's something that we're expecting coming up soon too. So that's kind of an overall view of what a pop-up event looks like. It's just making sure that you have all the equipment that you need, but a lot of times you'll have to depend on your partners for that, whoever is actually doing the immunizing to bring all of that stuff. Your responsibility or the health partner's responsibility would be making sure that the venue itself is ready. So like tables and chairs, and making sure that you are in touch with Walgreens or whoever the medical partner is to make sure that you have like enough tables, enough. And if it's an outside area, you want to make sure that you do it on a tent, or you make sure it's ADA accessible, especially for patients who are, who need that extra help, or so those are just specific things that, most Walgreens and most pharmacies have done these sort of events already. So you definitely utilize their expertise. For Walgreens, we all have vaccine leads, or basically people like me who all we're doing right now is coordinating these events and making sure that they're running smoothly. And we're the point person for a lot of it. So generally, most organizations would have that as well. So you want to make sure that you're in touch with them, whoever that local contact may be. And so the next portion, or the next question is, how does the vaccine work? I'm going to go over that, but I want to talk a little bit about vaccine hesitancy too, and then we'll go over the facts. And then that way, when I talk about how vaccine works, it kind of ties into all the clinical stuff that Charlie's going to be talking about as well. So when we're talking about vaccine hesitancy, it's not driven by one thing, right? It's many things. Health for each person is personal. So the message and how we help patients overcome the hesitancies needs to address their personal experience and their situation. So for Walgreens, we're taking, a multifaceted approach to that includes first and foremost, our pharmacists, right? So our pharmacy teams have played a vital role in fighting this pandemic, with our pharmacists and our pharmacy technicians leading the charge in not only administering the vaccine, but also to rebuild trust and to dispel any misinformation, because that's definitely rampant out there. So our pharmacists are familiar faces and trusted health resources embedded in our communities. And as these highly accessible points of care are readily available to the public, pharmacists can help educate patients about the vaccine by giving the patients relevant personalized information based on their health history, their situation and concerns, as well as sharing the latest information available from public health recommendations. And Walgreens pharmacists, many of them multilingual and Spanish speaking, are available in person in nearby Walgreens stores or online every day. And as a pharmacist, I'm very passionate about being a healthcare provider, especially during this pandemic, right? So some of the things is, I have a lot of patients, especially in downtown, who some are vaccine hesitant, some have mental issues, some have, psychological reasons for why they don't want to get a shot and things like that. And so those are all the people that I would have to have like a one-on-one session with to really talk them through all of their questions and concerns. So some of the things that I do, first is definitely speaking with empathy and coming from a place of just compassion and understanding, putting yourself in their shoes and trying to understand why, right? And but a lot of the things that I do first is I always ask them open-ended questions about what their understanding of the virus is first, getting kind of a good kind of understanding what their level of understanding for the vaccine is, and getting to know what their concerns are, right? So once they tell you what they think the vaccine is, or how they think the vaccine works for them, or things like that, then we can either affirm the information that they've provided us, or that we can educate them, right? If they're giving us wrong information or something that doesn't make any sense, we want to make sure that we're correcting them and educating them on that. And then allowing them to ask any questions, allowing them to bring up any concerns. For me in the pharmacy, obviously it's easier for my patients to have that because we already have that rapport, and and they're very comfortable with asking me anything, right? So we're not going to have that same kind of interaction possibly out on the streets or when you're doing your pop-ups and things like that. But just let them know and be very open, and just, with your body language, with your tone and everything, just say, that, hey, if you have any questions about it, I am more than welcome to answer it, or more than welcome to help you with that. I want to make sure that you have every concern that you have about the vaccine addressed, so that you can make a decision for yourself. Because a lot of times people are talking about choice as well, right? So you want to make sure that it is still their choice, and that you're just giving them all the information, and all that information is hopefully percolating in their brains, and they'll finally make a decision to go ahead and get vaccinated. And then be transparent. If there are any questions that you are unable to answer, just make sure that you let them know that, hey, give me a second, let me double check. And I'm always more than comfortable to do that. That if somebody asks me a question that I'm not 100% sure about, that I telling them, I think the answer is this, but give me a second, and then I'll just double check my sources on my phone or something, so that I'll be able to answer them correctly and make sure that I give them the right answer. So lastly, you want to make sure that you close your interaction with whoever it is, whether it's me with somebody I know in the pharmacy, or me with somebody on the streets outside, is to personalize the importance of why they need to get the vaccine. And that has to do with, like for me, when I'm in my pharmacy, I know so-and-so has a mother who just went through cancer, or so-and-so has children, or whatever. And I can use that to personalize that getting the vaccine is not only for their health, but also for the health of other kids, and kids who are not old enough to get protected yet. And let them know that the more that the virus circulates, the more variants are possible, then that leads to more infections and more deaths. And that with each shot that goes into someone's arm, we're getting closer to ending this pandemic versus, people being hesitant and prolonging it. So the sooner that everyone gets vaccinated and we reach herd immunity, which Charlie will talk about a little bit more, the sooner life can get back to normal. So some other things that our company is doing to try to combat vaccine hesitancy is that there is definitely content on our website and social media. We're producing content daily and even hourly sometimes, to ensure that our patients have the latest information at their fingertips, be it through our website, videos, and other materials. The partnerships like the one we have with LULAC. So we work collaboratively with civic leaders, advocacy groups, and faith-based organizations to offer educational programs that build trust in the COVID vaccine safety and efficacy, and to host vaccination events. For example, we joined the Ad Council for COVID-19 Vaccine Education Initiative in an effort to help raise awareness about the importance of COVID-19 vaccines in reducing community spread, as well as build confidence in vaccines and increase vaccination uptake. particularly among Black and Latinx populations. And partnering with these community organizations really allows us to help get credible information to these medically underserved communities and reduce vaccine hesitancy. We've also contacted our company has also been in contact with influencers to drive more confidence and trust in the COVID-19 vaccine as well. We are working with diverse influencers, which may include social media influencers, celebrities, community leaders, and government officials. And these individuals are considered trusted voices and can share their personal experiences about why they chose to get vaccinated. And for you guys as volunteers and for myself as well as a pharmacist, sharing our personal experiences on why we got vaccinated is also a very good way to speak to people about the vaccine itself. So just speaking about how does a vaccine work? Basically, this is a little bit of the clinical portion. So the vaccine works in the simplest terms. The vaccine trains your immune system to know how to fight the virus once it presents itself. So an analogy that I hear a lot and that I've used actually myself before is like a bolo. So basically, if somebody commits a crime, what happens is that, it gets broadcasted, this person's picture, what they did. And so basically this picture's everywhere and it's a bolo, like be on the lookout for this person. And all of the cops know where to, all of the local law enforcement, everybody knows what to look out for. So once this person pops up, then they immediately take action and they are able to arrest this person and and then convict them, take care, do whatever they need to do to make sure that he's out of society and not committing more crimes, right? So that's basically similar to what we're talking about with the virus, is that no matter which vaccine you're using, the whole purpose is for them to expose your body, expose your immune system to the spike protein that's in actual virus shows up to try to infect you. Then your body already has practiced and already has prepped itself to be able to eliminate the virus. And that's the whole point of the vaccine. And the goal of the vaccine itself is not necessarily to get to zero infections, because, as we know, with like the flu vaccine and other vaccines that we've had previously, that's pretty much impossible, right? But the whole point is actually to tame this virus, to kind of defang it, and to remove its ability to cause serious disease like hospitalization and death. And every single vaccine out there is pretty much close to 100% effective on that. So you are seeing a lot of reports now that are saying that they can that people who've had the vaccine are infected. And that's something that's going to happen. But of the people who've had the vaccine and got infected, none of them have required hospitalization and none of them have died. And that's the most important part that we have to make sure to convey to people, that even if you get the vaccine and you do get the virus, the whole point is to make sure that your body can fight it. So, so there are going to be some concerns about the side effects of the vaccine. Most people do not have any serious problems after getting vaccinated. I mean, as a country and globally, we've vaccinated millions of people across the nation. And
your comments.
Got it. Yeah, I could do that. Okay, I was just confused. Okay, so right now, I guess I'm just addressing some of the questions that we generally get from the field. And basically that's people who are concerned about side effects, Most people don't have serious side effects after being vaccinated. We vaccinated millions of people by now and have very few incidents of extreme side effects. The side effect profile looks pretty similar actually to what you would get with a flu shot, with mild symptoms such as headache, fever, or pain and swelling in the injection site. Most of these can be cared for at home and resolved within a couple of days. These side effects are actually a sign that your immune system is doing exactly what it's supposed to do. It's working and building up protection to the disease. Some people will get side effects, some people won't, but it doesn't mean that it's not working. It's just like when I got the shot, I was out for 2 days. I had like 103-degree fever and everything, but I'm so grateful that I got the shot and that it was only for a couple of days, right? Because if I actually got COVID, I would be gone down for even more than that, and I would feel probably a lot worse. So can the vaccine give me COVID-19 is a major concern, especially for people who are getting ones that are using a virus vector, a viral vector, but no, the vaccine does not cause COVID-19. It does take a few weeks after the vaccination for your body to really build up those antibodies to protect you from the virus. But so that means that if you were to take a test or something, you might possibly show up, but usually it doesn't. So, but because of that delay in getting you fully protected, it does mean that it's possible you could get infected with the virus that causes COVID just before or after getting the vaccine and still get sick, which is why it's important that people are still socially distancing and wearing their masks. But it's also very important to get the vaccine because it'll reduce your chances of getting symptoms and especially reduce your chances of being hospitalized and, you know, having something horrible happen. So should I get vaccinated if I've already had COVID-19? Yes. You should still be vaccinated because you can become infected more than once. And although you may have had some short-term natural protection from recovering from COVID, we don't actually know how long this protection will last. So vaccination is the best protection. And lastly is, of course, the big question is the vaccine safe? And Charlie will definitely dive into that, but yes, they are safe. And vaccines have played an important role in protecting the health and safety of communities throughout history, right? So we have tons of vaccines out there that we've been using since we were children, and they are definitely safe. And they have, you know, the manufacturers and FDA work very closely to review all the data from all the clinical trials and all the safety checks before they were even allowed to issue an emergency use authorization, which Charlie will talk about. And by now we've actually vaccinated so many people that, you know, definitely can, you know, rule that it's in general that it's safe, right? And so very important to make sure to convey all of these questions, you know, when people ask these types of questions, to make sure that we talk to them and let them know. And then there's going to be people who have crazy questions, right? The questions that, you know, they heard from someone's aunt's friend's mother had something, right? And those are different. And, you know, we just want to make sure that we are coming at them and answering their questions in a way that shows empathy and understanding that for some of these people, it's a real concern. You know, there are stories about people thinking that they're going to be magnetized, or people who think that there are microchips in liquid somehow. You know, but for these people, they actually believe that. So we want to make sure that we are empathetic to their concern and that we address them, you know, and let them know that no, there's no microchips in your vaccine. No, you will not be magnetized as a result of getting vaccinated. And, you know, things like that. And then there are other ones that are more concerning. So I know that I think the beginning of the year, there was concern about Johnson & Johnson and about people getting blood clots and things like that. So we just need to educate them about the numbers, right? So during that time, there were 6 women about the age of, I think, 30 to 40 who died because they had blood clots and they had gotten J&J. So these were 6 women out of millions of people who got it. So, the incidence itself is very low. So we just need to make sure that we talk to them in a way that they understand that the risk of getting an extreme side effect like that, or even whether or not it's been caused by the vaccine, is still something in debate, right? And, the risk of those kinds of side effects are very, 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 very rare. But the risk of getting COVID because you haven't gotten vaccinated, and then as a result having to get hospitalized, that is increasing by, crazy amounts, right? Especially during this time with the Delta variant. So we just want to make sure that we're weighing, helping them weigh the benefits and the risk of getting the vaccine, and making sure that they have a good understanding of it. And so that's pretty much all I have in answering these questions. So if there's more questions, I don't know if you want me to do that now or later. Some of those questions may be answered by Charlie in his portion. So
absolutely. Thank you so much, Jeannie. I thank you for all the information that you've shared. I know that our councils are definitely going to be taking that into account as they start having those conversations with the community. And again, I know we'll have some questions that are coming after Charlie's portion. Of course, we'll go ahead and take some Q&A if your time allows for it. I know we're running a little bit over. But
sorry.
No. We'll try to go ahead and go through. I know there's, we have so many questions out there. And again, just thank you guys for so much for your time. Charlie, I want to go ahead and pivot to you. I know Jeannie really did a great job talking about working with the community, bringing those services in. I think that there's a lot of questions about what happens on the front end when we're starting to develop these vaccines and being able to go ahead and, start to make this happen for distribution. So can you give us a little bit of insight what clinical research is, what are the approval processes, what is immunity, how do the vaccines actually work, and just being able to give us some of that background information. So if you can start off with just sharing a little bit of insight on clinical research.
Sure thing. Thanks, Sandra and Jennifer and the entire team for bringing this together. Really happy to represent Walgreens here with Jeannie on this topic. I may skip over a couple of these questions just so that we may have more time for a Q&A at the end. I think some of it was covered by Jeannie, so we'll leave it at there. But again, happy to be here on behalf of Walgreens. So excited to partner with LULAC. Again, my time with Walgreens goes back over 2 decades now. And I remember countless times where I partnered with local LULAC and national LULAC organizations to do work around diabetes screening, cholesterol screening, HIV prep work. So it's been exciting, glad to come together on something like this. Immunizations, something that I am so passionate about, something that Jeannie's so passionate about, as well as our other 25,000 pharmacists and 50,000 technicians across the country. To be able to bring this. One of my last years in practice was in 2009, 2010, which you all will remember was the H1N1 pandemic. It was sort of pharmacy's first foray into the immunization space. And boy, we've come a long way since then. My first clinic was in fact a pop-up clinic at a parking lot nearby one of our stores, and we had 12 people come and get their flu shot, and I was pretty excited about that. But now you hear Jeannie's, we're running 1,000 people clinics, so it's definitely come a long way. And I think that is a good way to describe why we've been able to kind of get to this point with a vaccine, is all this time and energy and effort and research that we put into immunizations over this last decade and a half that allows us to be here. One of the main concerns that you've highlighted and Jeannie hears from many of the patients is, we heard of other vaccines that have taken such a long time to come into production. I've been waiting on it because, I live in a place where the incidence of that disease is very rampant, and we've been waiting for vaccines to come across, or my family members suffer from a disease, if only there were a vaccine to prevent it. And so you hear about the stories of how long it takes for vaccines to make it. And it's true, and it can be true with regular drugs too. One of the questions here is, under normal circumstances, what does the timeline process look like? Can't give you an absolute definitive number, but I think 10 years is a good, nice round number for you to kind of think about. If we think of some of the most recent vaccinations that have come to market, you might know of the Shingrix vaccine that's used to protect against herpes zoster. And then you might have also heard about the HPV vaccine, which is meant to protect against human papillomavirus. And these are both vaccines that have been developed, say, in the last decade and a half. Both of those started off in research that preceded it about 10 or 15 years. So it took 10 or 15 years to get to market. So what happens in those 10 or 15 years? Well, clinical research typically starts in a lab, and it may be a remote lab somewhere that's not connected to a pharmaceutical company, not connected to a bigger institution. It's just scientists trying to learn a little bit more about a disease, and they work with these products in a lab. And as they learn a little bit more from those initial findings, to know that there may be a possibility that you may be able to bring this to ultimately be used in a person to protect against disease. So it goes from research in a lab, in a tube, to doing other types of technologies to understand it, to doing tests in animals, to ultimately doing tests in humans. And when you get to the point of testing in humans, you have to follow very distinct phases of study. We know them now as phase 1, phase 2, and phase 3. And phase 1 is typically a study period that's maybe 20 people, maybe up to 100 people. And this is mainly to just determine, is this product safe? Meaning, if someone takes this, are they going to stay alive? They're not going to drop dead. And that's the main purpose for your phase 1 study. So that takes a lot of time to recruit those folks and make sure we can give them the product and then follow them over a short period of time. We then move on to phase 2. In phase 2, now you're starting to get into several hundreds of people that you have in trials. And that is also to continue to follow the safety aspect, but you're really starting to understand, what is the efficacy here? Does this product help our bodies to, as Jeannie put it out before, to mount that immune response to help against this infection? So then that goes on for a certain period of time, and those data points have to be submitted and reviewed, and on and on. You then can finally maybe move to phase 3. And phase 3 are your what they consider large clinical trials. These are thousands of patients. In the case of the 3 vaccines that we talked about today, with the Pfizer, Moderna, and J&J product, Pfizer had almost 40,000 folks in their phase 3 trial. Moderna had around 30,000, and J&J had about 45,000. That did include a global component, but you can tell the number of people. Well, it takes a long time to recruit 45,000 people. So the effort that it goes to recruit them, to educate them, make them aware, get their consent to do so, and then to have them come in to get the product, make sure they come in for a follow-up, all the reporting that has to go with it. When they have to call back in to say, hey, this is how I feel today, or this is a side effect that I experienced a month later, there is a lot of back and forth that goes on with that. When you can eventually get to the end of phase 3, that you reach certain milestones that let the researchers know that you're kind of getting the response that you want, and you're also meeting the safety guidelines that you want, that company will then start the process of applying to FDA to say, hey, here's a candidate we have for a vaccine against this infection. This is all the data that we have to support it. This is all the safety information that we have to support that it is safe. And so now that is now with the FDA, for their independent data safety review boards to review it all and to ultimately make that decision. In between, there's a lot of exchange of files back and forth between pharmaceutical companies and the FDA. They need to come and inspect the manufacturer's facilities and make sure everything is okay with that. They have to understand the global market and sort of the distribution around products like this. They have to understand storage. So I'm being very deliberate in listing out the steps. I'm almost wearing myself out talking about it, but it is the reason why these 2 previous instances that I described is why you come to 10 to 15 years to get a vaccine on the market. So now what happened here? Well, we For all intents and purposes, we discovered the SARS-CoV virus November, December of 2019. And in December of 2020, we had a vaccine. So that was 1 year. So we went from 10 or 15 down to 1. How did we do that? I think maybe a good way to maybe say it, I'll borrow a part of Jeannie's analogy when she talked about everybody kind of coming together on the bolo. It's law enforcement, it's volunteers, it's community people all coming together. That's what happens in an emergency or pandemic. People have to come together to decide that we have a crisis in front of us, and we do not have the luxury of 10 to 15 years of allowing this virus to just spread. So we need to truncate this timeline. Now, what those folks are very insistent upon telling you is that all those steps that I mentioned, the maybe 12 of them, none of them got missed. None of them got missed. They just were not spread out over 10 to 15 years. When you have all of the pharmaceutical companies, when you have the NIH, when you have the FDA, the CDC, all of the academic institutions across the country, many health systems across the country, independent labs, all coming together to work together, to share information, to say, hey, this is what I know about this virus. This is how it acted here. This is what we're learning from the international partners. You are able to quickly assimilate all that information and allow these pharmaceutical manufacturers to get on their way. And so that is what allowed both the companies of Pfizer and Moderna and Johnson & Johnson to accelerate the timelines, not eliminate the steps, but accelerate the timelines to be able to show to FDA that these products are effective and that they are safe. And because of that, the FDA granted all three of these companies what's known as an emergency use authorization. An emergency use authorization has been around since 2005. It was established in a law that was passed called Project BioShield back in 2005. So the basis for this process has been around for 16 years now. And there are definite standards within FDA's playbook as to how a product can meet the standards of an EUA. So that is well known and that is well established. And when we got into this, the FDA was very deliberate and very frequent with all the manufacturers as to this is what we want to see if we are going to approve this emergency use authorization for you. And so because we know those standards are established and they're based in clinical science and clinical research, we can be very confident that these vaccines hit these milestones all along the way to put us in a stage where we are confident now. I'll leave with, I mentioned the phase 3 clinical trials, 45,000, 30,000, 40,000. That sounds like a lot of people that they followed for, let's call it anywhere from 6 to 9 months. But as Jeannie put it out, we have real world evidence now. We have hundreds of millions of Americans that have gotten vaccinated. We have over 1 billion people across the world that have gotten vaccinated, and they've been getting vaccinated for nearly 10 months now. So we have real world evidence, which is way, way better than all the clinical trial evidence that you can ever get. So to see where we are now, to see where the effectiveness of the vaccine is and see where the safety of the vaccine is, I think we can move forward very collectively. So I'll wrap with, was it fast? Yes, it was fast. Was it too fast? No, it wasn't. And so I'll leave it there. I know we went all the way, but please, I know folks may have some questions, so I want to leave some time for that.
Absolutely. Thank you so much for that rundown. And I know we are running a little bit late on just the timing. I know Jeannie covered a lot of misinformation points, as well as directing some of the efforts towards youth and young adults. With that, with the first training that our councils received, we did give them, the rundown of what the goals were with our initiatives, and really being able to talk to the community, as well as the additional resources that we have here. So I think that having both of you on here is incredibly helpful to really be able to understand what the undertaking of developing a vaccine to battle COVID-19 and the importance that everybody plays in this. You as healthcare providers being able to have Walgreens join us, LULAC being a trusted name in the community, really being able to go ahead and share this information. It really is a group effort. There is strength in numbers. So again, thank you guys so much for sharing that information. I know we've had a couple of questions come up in the chat, and I know some of you may have some questions as well. I'm going to go ahead and dedicate a couple of minutes to answering as much as we can. Should we not get to your questions, please copy us, Jennifer and myself, on the Vacunate email. We can go ahead and compile compile this and possibly share with the Walgreens team as well, and provide those updates just for the councils to have as well. So I do want to go ahead and go to one of the first questions that we had, which was vaccines for children under 12, are coming. What does that timeline look like from your perspectives?
So right now, all I keep hearing is fall, right? That they're hoping to get it out by fall. But for obvious reason, because they are children, we want to make sure that we're not rushing that process and that we're giving them as long of a time interval as they need in order to test it and make sure that it's safe for the kids. But right now they're saying fall. So that's what I'm hoping for, and that's what we're shooting for. We definitely do a lot of like school clinics and things like that. And once that rolls out, we're definitely want to make sure that parents have the opportunity to vaccinate their kids that are under 12.
And one quick thing that I'll add, and to help everyone understand the safety behind it. So they have been conducting the trials in the 5 to 11 group and even all the way down to the 6-month group since back in April. So these trials are going on. In fact, Pfizer indicated that they were probably going to be ready to go in September, so just in a couple weeks. But the FDA was very specific with all three with the other 2 companies now, is that they actually extended the trials that they wanted for kids, and that's even the 12 to 15-year-old groups, than they did for the adults. And with the 5 to 11 and younger specifically, they've added that they wanted additional participants in a trial before they're going to approve it. So it just goes to show you that the FDA understands all of the uncertainties that may exist with vaccinating the pediatric population, and they've put those stipulations in place so that they have all of the safety and effectiveness data that they could possibly have.
Thank you so much for that explanation. And then Rosemary from Council 313 is asking, the majority of the attendees at their pop-up clinic will be receiving the first vaccine only. How important is it to have information on where they can receive the second vaccine, and how much time do they have to receive it?
So the important thing to know with pop-ups is we always give options. We always try to make sure that we have both the Johnson & Johnson, which is only 1 shot, because some people may not be able to get the second shot, or some people may not want to get a second shot, right? So we want to make sure that we give them the option to only have the 1 shot. The second thing is it is definitely very important to give them information on where they can have a second vaccine. Either if you're going to have a second pop-up clinic in the same location in, the 21 days that you need to get the second shot for Pfizer, or 28 days that you need to get the second shot for Moderna. To just have a second pop-up in the same location at the same time, so that those same people are able to have access to that. The other thing is, like for us, for Walgreens, our easiest thing is that if you're not near, if people are just like, let's say we have something in the middle of like a public market or something, and they don't actually live there, then we always let them know that their options is that you can walk into any Walgreens, and Walgreens will be able to administer the shot. And generally, we do have a lot of the Pfizer and the Johnson & Johnson, so they just have to make sure that that pharmacy has the shot that they need. So.
Perfect, thank you. And I did get a couple of questions on the private chat. One is asking about a third booster that is, I believe, has been approved, and how that would possibly work into those that have been fully vaccinated and those that are looking to get vaccinated.
Well, the great thing about our pharmacy and most pharmacies is that walk-ins are welcomed. So if once the third booster right now is only approved for people who are immunocompromised, or for people who are who need the third booster. So they have to have a qualifying condition, but eventually they're probably going to recommend boosters for everybody. That hasn't come out yet. But the great thing about, utilizing the pharmacists and the pharmacy technicians to do these immunizations is that you can basically walk in anywhere and they should be able to do the same one.
Great, thank you. And then Eliseo is asking, many are asking for a specific vaccine. From his experience, most in demand has been Moderna. Are there a choice of vaccinations that we can request from a health partner, or is it just depending on the availability that our partners may have?
Well, right now I would say it would depend on their availability and their resources. I've had to special request stuff from like the LA Department of Public Health to go ahead and send me some for a clinic that they actually want to do. But the most important thing is to let them know that no matter which vaccine is available, they should just get, or no matter which vaccine is there, they should get the one that's available, because all of them have basically 100% protection for against hospitalizations and against death, right? So no matter which one, there's actually really great videos on like YouTube and stuff about not comparing the three just by the efficacy numbers, but also by comparing, other things that because those numbers are based on the clinical trials, and those clinical trials were done at different times and different peaks of the pandemic. So you can't really trust just the efficacy numbers. So I would approach it by asking them, why is it that they want Moderna? And if that's the reason why, then you can speak to that, and also let them know that no matter which one you get, you're going to be protected against hospitalization and death and severe symptoms. So
really great insight. And then I know we have two more questions. One is this going to be a yearly vaccine? How long does immunity last for those that have been vaccinated or are looking to get vaccinated?
So you're going to hate my answer, but we don't know. So right now there's still a lot of research out there. We're still waiting to find out if it's going to be a vaccine that we have to do yearly, like the flu. Dealing with all these variants and all these changes right now, it sounds like that's possibly a way. I know that there are people, or there are companies out there that are trying to invent ways to combine the two and stuff like that. So, there's a lot of things that are going to be going on between now and the next year. Hopefully, if we can get enough people to get vaccinated and kind of like just get this under control, maybe there's a possibility that we don't, but because it's been so long and there's so many variants and there may continue to be more and more variants, it is completely possible that we will have to have this annually or maybe a different period, different stretch of time. So.
Mute monster. So I know we have, we'll take one more question, and I know that we will have a couple of overflow questions, and we'll certainly follow up with you and the team just to see if we can get those answered for those, because I know we are 10 minutes over. Last question.
I'm sorry. That was me. I'm sorry. It was because I overran my time, I believe. So
no worries. This is incredible information. So last question, are COVID vaccines always available at a Walgreens, or do you recommend people signing up for a wait list, making an appointment, or is walk-in a fairly good option?
Walk-in is a fairly good option, just because it's not like in the beginning when we were definitely rationing all of those vaccines. Right now there's vaccines everywhere and it's available pretty much everywhere. And so as you know, walk-ins are welcome. I don't think any of the stores that I manage or anything like that, they still have any sort of waiting list anymore. For the most part, you know, the whole goal is to use whatever we've got. And most of the stores will have a supply, and most of the stores by this time have gotten really diligent and really great and efficient at making sure that they have enough vaccine so that they don't run out ever.
Wonderful. Well, thank you guys so much, even with technical difficulties. Thank you for your patience. We really appreciate it. It had to be a Monday. But again, you know, this information is just invaluable to our councils as they're starting to go out and work in the community and really try to push for folks to go ahead and take the next step in getting vaccinated. We will be sharing out this presentation for everyone to have available and also for reference. Again, thank you so much, Jeannie, Charlie. We really appreciate your partnership. Walgreens has just stepped up for us in a way that we cannot thank you guys enough. So thank you so much for joining us today, and we will be in touch for any additional trainings and resources that are available to our LULAC councils. Thank you.
Thank you, and thank you to your volunteers.
Thank you.